I have always been fascinated by the fact that wherever people of Indian origin are in a sizable minority, the suicide rate is the highest among the Indian people of Indian origin in all these countries. For example, Suriname, Guyana, Fiji, Mauritius. In all these countries where there is a sizable Indian population, the suicide rate is high. So this is also one of the reasons why I want to understand why people of Indian origin have a high suicide rate.
That was Dr. Lakshmi Vijayakumar, a psychiatrist from India who is in Guyana as part of a team aiming to study the risk factors of suicide in Guyana. Earlier research conducted in these countries indicated a link between suicides among Indians and persistent poverty, alcoholism, and mental illness. But Dr. Vijayakumar says that no multi-country study has been done to understand why this has happened. In Guyana, according to data collected in 2020, more than half of the people who died by suicide were people of East Indian descent. That was about 68% of the people. Even though there's this pre-existing research, Dr. Vijayakumar says she is interested in more.
It has not been studied, and that's one of the reasons why I'm here. It has not been studied. We have not had a multi-country study. Why Indians in Guyana? Why Indians in Suriname? Why Indians in Fiji? Why Indians in Malaysia? Why Indians in Mauritius? Why these people have the highest suicide rate when compared to the local population has not been studied at all. We only know that the prevalence is high, but we do not know why.
According to data from the Ministry of Public Health, now the Ministry of Health, in Guyana on suicide in 2016, there was a high prevalence of suicide predominantly among East Indians in the rural communities of East Berbice Quarantine. Dr. Vijayakumar is part of a team in Guyana that will be conducting research on the risk factors contributing to the prevalence of suicide in Guyana. It is expected that the research will help to inform more targeted interventions to promote mental health. On Monday, Minister of Health Dr. Frank Anthony said that the ministry will seek to incorporate the team's research into its new strategic plans for the mental health sector. Reporting for the newsroom, I am Vishani Ragabir.